We actually have a vaccine distribution system that gives out 170 million doses of a single vaccine every year. And it works really well.
This is A New Angle, and I'm your host, Justin Angle, marketing professor at the University of Montana College of Business. This podcast is my chance to speak with cool people doing awesome things in and around the great state of Montana. We are proudly underwritten by First Security Bank and Blackfoot. Hey folks, welcome back and thanks for tuning in. I'm here today with Bryce Ward for our December edition of Incentives and Instincts. And it occurs to me, Bryce, that we've been doing this series for a year already now. Can you believe that?
Time feels so weird right now.
It does.
On the one hand, yes, I'm like, yes, we have been doing this for a year. In fact, last month I actually went back and listened to them all. Not all the COVID
Okay.
collabs, but
Wow.
all of the INIs. I was like, are these any good? With the perspective of distance, and yeah, I was like, you know what? We were doing good stuff. We
Yeah,
still
we've
are
done
doing
some
good
stuff.
stuff.
Yeah. Well, hopefully, it continues. We survived another month. I mean, we started our conversation before we recorded with, we made it to December, and we have. And under the circumstances, making it another day, we could chalk that up as an accomplishment.
Every day's a win right now.
Indeed. So, I want to check in. We're sort of overdue. You mentioned the COVID collab. That seems like ancient history at this point, but COVID is pretty salient at the moment. We made some dire predictions last month in our episode with Charlie Warzel. Do we know much about potential Thanksgiving effect on the case counts, at least here in Montana? Can we say anything about that yet, Bryce?
Here in Montana, we're on a downward trend. So, it's kind of flattened out, which is probably the Thanksgiving effect. I mean, nationally, we definitely see a Thanksgiving effect, right? Like we had kind of started turning a corner. And yeah, there was some Thanksgiving interruption in testing and all that kind of stuff. But, before that, we had started actually reducing cases for a few days. And then you have this Thanksgiving. We don't know what happened. But yeah, now we're back to setting new records on cases, and the line is still pretty steep. So I would call that, the cases that we're seeing right now are either the direct Thanksgiving or the, you know, 1 degree removed from Thanksgiving. And, it's not as bad as I was worried it was going to be.
Okay.
So
Yeah.
that's, I guess, the good news. But there's definitely been, you know, an increase in cases, and both anecdotally and then based on just literally the patterns we see in the data, it's pretty easy to say, yeah, that's a Thanksgiving effect.
Yeah, and we'll sort of have to see what happens with Christmas and other holidays as we move forward into the next weeks.
To not focus on the negative, it's worth focusing on the fact that many people are adapting their behavior, and we focus a lot of attention on the people who are behaving in ways that we think are slightly or maybe grossly irresponsible. But it really is true that a lot of people changed how they did Thanksgiving, if not
Mm-hmm.
canceled it altogether. I saw a survey this morning, which, it's like 40% of people are like almost fully isolated, right?
Wow.
They are not spending appreciable time with people outside their household indoors. And, it's more like it's 20% who are pretty cavalier and are spending lots of time with lots of different people indoors for prolonged periods. And then the remaining 40% are kind of somewhere in between. And so, it's worth acknowledging that. I mean, I saw one survey, which, you definitely, it's a panel survey that, people fill out every 2 weeks. It's this USC Dorn Life poll that people might have seen during the election. But they also have a bunch of COVID questions. And one of their sets of COVID questions are about social interactions.
Mm-hmm.
And, you know, things were getting better before Thanksgiving. But Thanksgiving really just brought us back to, at least in that survey, to, kind of the levels that we were observing in early October. And so, it reversed stuff, but you did not see what you would normally expect to see at Thanksgiving, which is, I think, like I mentioned last time, like 85% of people in the United States typically spend Thanksgiving with people outside of their household. And so if it were really only 40 or 50% that did it, that's still a huge change relative to what we would expect. And so while we still, and then you add in all the people who modified it and changed it or shrunk it. And, you know, it's worth acknowledging that while not everyone is doing everything that we want them to do, given that that's really hard to give up time with family and all that kind of stuff. The fact that so many are is worth at least taking a moment to appreciate that there are many people in the country who are responding to the information in the ways that collectively I think we want them to.
Yeah, and I think ultimately, like that's good news in the sense that you're probably never going to get 100% compliance with some public health edict and recommendation, but the fact that folks are making good faith efforts to be responsible citizens. I mean, that's refreshing. And you mentioned, I think, in your prediction last month that people have to fulfill their needs, and this balance between our family needs, our mental health needs, our well-being needs, and protecting ourselves and our community from the virus. I mean, those are trade-offs that all of us are trying to individually navigate, but as a society, we're navigating as well. And just the numbers you quote there indicate that at least a lot of people are thoughtfully approaching this as best they can. Is that a reasonable conclusion?
Yeah, and I think that's that, exactly, right? And in a free society, that's really all we can ask,
Exactly.
right?
Yeah.
We want to people are responding to information, right? And that's, and we see that time and time again. Cases go up, deaths go up, people start pulling back,
Hmm.
right? Now, part they're doing it for their own reasons, but in part they're doing it because of the thing that we really want, which is that they're concerned about other people. And,
Right.
we want people to say, ooh, cases are bad. Let's pull back. And we certainly have gotten probably too far in the, let's shame and attack and, people who are doing things that I don't like them doing, right?
Indeed.
Particularly given that, yeah, I mean, people have to do what, I mean, when it's done maliciously, right? Or I'll put in the gray area the people who are believing conspiracy theories, right? I don't know what to do with them, right? They're a bad actor in that they have chosen to believe a conspiracy theory. But to the extent that they actually believe the conspiracy theory, they're not, I mean, the worst is somebody who's like, yeah, I know this is dangerous and I'm just going to do it anyway.
Sure.
But, like there's a bunch of challenges here in terms of how do we evaluate people and how do we evaluate our society, and we haven't been good at those conversations, right? We've been very much like, you're supposed to do this. And if you're not doing everything that I think you should be doing, you're bad. And, I don't think that's particularly healthy. And that's why I'm back in the COVID collide. So I talked a lot about, it really is a time for grace, right? Like, unearned appreciation and benefits, right? Like, okay, you didn't earn it, but I'm still going to like treat you like a human being. And, it's difficult and it's going to be, Christmas is going to be, Thanksgiving is bad, right? People go out and they mix, do all that kind of stuff. But Christmas, it's like Thanksgiving's one day. Christmas and all the stuff that tends to go around it is more than one day,
Indeed.
right?
Events leading up to the new year and that particular event and gatherings around that.
And so, I mean, I hope that people will do like, yeah, okay, we're not going to give up Christmas altogether, but we won't have as many people or fewer people will actually show up. And, maybe we'll cancel, I'm hoping, all the other parties. We don't need all the other holiday parties that are, if you need to, do your family, but maybe don't, have the neighborhood Christmas party and the office Christmas party and all that kind of stuff. So hopefully we'll also help mitigate the spread. The cases that we see right now, like I mentioned last time, everything that we observe now, we know amounts to a certain percentage of those will be deaths in 3 weeks, or on average anyway. And with what are we at? 200,000 cases a day now? Is that where we're,
Thereabouts, yeah.
you know,
3,000 deaths.
yeah, that's gonna be ugly come New the, right now we're seeing the New Year cases, right? So yeah, we'll be at 3,000 or so by New Year.
Mhm.
So hopefully we'll bring it down at least in the in between, because look, every time we avoid cases, there's a whole cascade of cases that come from that, then a whole share of deaths that are in its wake, and so you know, hopefully people will. Yeah, I guess one way of thinking about it is that you have a little bit of a budget for social interaction, right? Meet your needs. We can't. It seems both unwise and impractical to try and do forced restrictive lockdowns. But, if we all kind of shrink our socializing budget constraint a little bit, particularly between now and Christmas, then we'll have a little bit more buffer in the system to allow for Christmas interactions and have those interactions have less virus show up at them, right? If we have less virus in the community in the weeks or 2 weeks leading up to Christmas, then it's less likely that there'll be a virus that shows up at your Christmas. So, because at this point, to be honest, the other thing is that with the vaccine out there, now is the time to actually really restrict. Before it's like, well, how long can I keep this up? Well, now there's
Yeah.
an end date,
Right,
and
right.
like it should give us a little bit of a recharge to say, yeah, well, I really don't want to get it now because I can not take that risk if I can get to a vaccine.
Indeed. And so you mentioned the vaccine, and that's something that we had kind of loosely planned talking about today. I mean, the news about the vaccines has been so encouraging about their efficacy and the speed with which the scientists were able to develop these vaccines, particularly the Pfizer vaccine. The story has been so positive. We're starting to see some cracks in that positivity as we think about production and rollout. There's a story in the New York Times yesterday about the federal government passing on an additional 200 million doses of the Pfizer vaccine. New York Times editorial board is out today with a pretty damning column and I'm going to read a piece from this. It says, in the coming weeks and months, health institutions across the country, hospitals, clinics, nursing homes, pharmacies, health departments, will face the unprecedented challenge of administering several entirely novel vaccines, some with stringent and complicated storage requirements, in the middle of a raging pandemic to a weary populace that tends to be public health averse in the best of times. Many of these institutions are running on fumes after years of budget cuts and months of unrelenting crisis, and most of them have nowhere near the resources that experts say are needed to meet the coming challenges. So, we're facing a big challenge with rolling out this vaccine at scale. And rather than kind of talking about that and making predictions about that, we got a really insightful listener question um, from a student, Travis Anklam, a graduate student in our environmental studies program here at the University of Montana. And he asks the following.
Hi, Justin and Bryce. My name is Travis, and I want to ask you who you think should get the vaccine first. We've got our tribal communities, small business owners, teachers, healthcare workers, the most vulnerable us. It's a lot to balance, and I want to know what y'all think about not who is getting the vaccine first, but who should get the vaccine first. What's the right thing to do?
So, great question from Travis asking about not how we're going to do it, but how should we do it? And it occurs to me that thinking about how we should design and execute on a vaccine rollout program is exactly the sort of problem that would be tailor-made for an economist. I mean, this has got to be right up your alley, Bryce. What do you think?
Well, yeah, I mean, like, look, when I was in graduate school, so my friends and we got tickets to go to a U2 concert.
Oh yeah, nice.
One of our friends couldn't join that. This was pre, like, right before. This is probably one of the last concerts we actually had to go and stand in line to
Mm-hmm.
buy tickets. So he couldn't go with us and stand in line. So we played a prank on him when we got back that we were like, "Oh man, sorry, Keith, but like we can only get this many tickets, and so because he had contributed and wanted to, he's like immediately goes into designing allocation mechanisms for
Oh
who should
gosh.
get the tickets,
Yeah, yeah.
and somehow my friend Dave kept this going for like, I don't know, 30 minutes, like before he cracked. Like the rest of us were like excusing ourselves from the room because we just couldn't. But yes, this is,
You
uh,
crazy Harvard economists and
uh,
your hijinks.
allocating scarce resources is kind of the name of the game for economists. And so, yeah, this is what we like to think about. Now, the normative question of who should get it is actually maybe not always the thing that economists maybe should be entrusted with. But
Right, right.
it is useful to start there, right? Because when we're thinking about this, right, it's one of the things I like to tell students when they're designing like a research project or something is give me your ideal version, right? Throw every constraint and every aspect of reality away, and let's find the ideal version, right? So it's useful to start with, okay, if we didn't have any constraints at all, even in reality, we had no, we could do whatever we wanted. Who would we give the vaccine to, and why, and what order, right? And that's an interesting question. And if you literally remove every constraint, right? If I were somehow omniscient, it's actually pretty easy. I would give it to the people who are going to die.
Yeah.
Problem is that I don't know who those people are.
Well, even within that though, Bryce, like how would you well, I guess we're eliminating the scarcity constraint because I'm thinking about when you say who is going to die, like one of the ways you can think about this too, and this sort of wraps into the should is, we're thinking about people that are already toward the end of their expected lifespan or younger people who, are at risk of death and have a lot of years in front of them. Like, how are you thinking about that?
Okay, yeah. So if we're still constrained, right? If we're still, and that's really where we are, right? We have to move
Mhm.
into some sort of probabilistic expectation, right? So then it becomes a question of, well, what are we trying to optimize?
Right.
What's the objective, right? And in a very abstract sense, right? We would say, well, there's two components. There's how much does each person want the vaccine, right? Because of their own concerns about their health or fears or
Sure.
whatever else they're trying to do. That's what we call the private benefits. And then we would say, well, how much do we as a society value you in some sense? That would be the social benefits, right? And so, we could imagine adding those two together in some sense, weighted in some sense, depending on how much we care about how much you want it versus how much the society wants you to have it. And we could put that together and we could imagine creating a rank ordering. Of course, again, that I can imagine mechanisms to get truthful revelation about the private benefits. How much do I want it? Right? That's kind of the market mechanism. But how much society wants us to have it? Well, that's a really tricky question.
Yeah, can we maybe draw out both sides of that? I mean, the private benefits, you're talking about like you mentioned a market function there. I mean, what I fear we should not get into is sort of people with the means to afford the virus can buy it and hoard it for them and their friends. That's not necessarily what you're talking about it, but how do we kind of understand how an individual values their desire to have the vaccine?
Right. So again, we'll get into the market at some point, but let's right now we'll just abstract away from it and we'll just say,
Okay.
well, look, each of us have some lurking inside of us is some desire
Hmm.
for the vaccine. And that desire is a function of a whole bunch of different stuff, right? So most obviously it's well, how much at risk am I? And, what's how much life do I have left? All that kind of stuff, right? So, there's well, I'll call that fear,
Yeah.
right?
Yeah.
And then there's also just like, well, I'd also like to be able to do a bunch of stuff that I can't do right now because it's irresponsible. And if I had the vaccine, maybe it wouldn't be as irresponsible. So there's kind of stuff on that side as well,
Hmm.
right? And so, and none of us value those things the same, right?
Right.
So, this is where things get tricky, right? And why we frequently end up relying on things like markets is because, we could do something simple, right? And we could say, well, look, we should just maximize total life, right? That's it. Don't worry about fear or subject, just basically say each person, there's an expected probability that you will contract the virus. We know that there's an infection fatality rate for people like you. So there's if you get it, whether you know it or not, there's an odds, percent that you're going to die. And we have
Sure.
rough estimates of that now. And then we know what your life expectancy is, right? And if we suddenly figured out, right, because right now we don't know this, but if we also understood that the vaccine actually prevents you from spreading the virus, we would add in the how many people are you going to give it to, and what are the odds that they die and what's their life expectancy, right? And we would just say, well, look, we want to allocate the vaccine to the people who will give us the total number of life years saved, right? That's a simple way of trying to abstract away from all this stuff. But
Hmm.
you know, it 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 weights every year of life the same. And some people might say, well, look, if you're gonna cure cancer, we should care more that you live than if you're just some regular Joe or something, right? So we're we could then, and that's the social benefit side of it, right? Is are some years of life worth more than other years of life?
Hmm.
Um, I mean, that's the
And
kind of
I mean, we're already kind of making those judgments with who gets it in terms of healthcare providers. I mean, there's frontline healthcare workers that are scheduled to get their initial shots of the virus very soon, maybe as this gets released, and that is the sort of kind of judgment that you're talking about in terms of the social demand, right?
Yeah, yeah. So that basically, what are we saying there? Why would we give healthcare providers the vaccine before other people?
Hmm.
Right. Well, it's because we're saying that two things. One, their odds of contracting the virus are higher than other people. So, there's some stuff that on that side, although depending on their age, their expected death and the expected years of life, all that kind of stuff, maybe wouldn't put them first in line. But there's a social benefit, right? Which is that, like, we need these people to be able to care for the people who still get it,
Exactly.
right? And so we're basically saying, sure, well, of course we want, there's this added benefit to, we need to make sure that there's the capacity to care for the virus. And so we have weighted, uh, giving them the vaccine before other people because of a particular social benefit that we think they're going to provide.
And I just surfaced that example by way of saying, a listener might be hearing us sort of framing this social benefit question as like, oh my gosh, that's not something that sort of society has the means to grapple with. And the point is, we're already grappling with it kind of at the, I don't want to say at the extreme end, but at sort of the obvious end of the spectrum. And as we move off of that obvious end, the choices and how we make them and what variables we weight, et cetera, get more complicated.
Yeah, and it's a very particular choice, and it's very obvious in the context. But if you remove it from context, right, it's not clear that we would make the same choice, right? It's
Okay.
like, oh well, of course we have, there's COVID risk here. We want these people to be able to treat COVID, so we should give them the vaccine. But we don't make the same choice in a lot of other situations, which, if we wanted to, we could say, well, that's pretty analogous,
Yeah.
right?
Yeah.
Uh, so it's, the I'm not saying it's the wrong choice. I want to be clear. I'm just saying that this question, the listener question about, well, who should be first, right? If you really kind of distill it down into its most simple elements, we have to make some decision about who's more important than other people and
Yeah.
why.
Hmm.
And we actually don't have a means of doing that.
A New Angle is brought to you by First Security Bank and Blackfoot, two cool companies doing awesome things all over Montana.
Hi, this is Anya Jabor, Regents Professor of History at the University of Montana, and you are listening to A New Angle.
Like, that's, we could have all, series of moral philosophy seminars in which we might, like, debate it, but we're never really going to answer that question because
Right.
it's, there's not like, you know, even if I said, "Oh, you cure cancer, so you're more," well, why? Why is somebody who cures cancer more important than somebody else? Well, it's because we've implicitly said that, well, you're saving lives and reducing suffering, right? But that's a choice, right? And so the short version is that there really isn't a right answer to who should go first, right? I'm well, whatever. I'm sure various moral philosophers or ethicists, if we had somebody on here, they could make arguments for why different groups should go first. But I don't think we would reach kind of a unanimous agreement on the social value of different people and why they should get vaccines first, right? So it's obviously it's inherently subjective, and therefore it's always going to be a source of contention.
Right, but at the same time, that's why it makes such an interesting and important question. I mean, we're going to have to make these choices as a society. We'll see sort of how society grapples with that. But let's kind of talk through how, if we were to try to navigate this problem. I mean, I can think of a few different variables you would use. You can use sort of, economists might use some sort of like productivity function. How productive is this person going to be? You might use sort of a risk factor, like how likely is this person to spread the virus to many other people? That's sort of an interesting way to reward that risk. It presents some sort of interesting trade-offs. I think about, I don't want to get too into the weeds of sort of policy to date, but I've always been baffled, and and apologies advance to my friends and colleagues who are in the restaurant and bar business, but how that sector has sort of captured so much of the attention of how we manage the economy versus things like school teachers. Frontline small business owners, restaurateurs, bar owners, etc. They provide an important social benefit to society. Same time, the long-term benefits of a teacher being able to do his or her work, and particularly at the earlier stages of education. I mean, those returns to society are well known and really important. So yeah, I mean, there's this whole host of variables. Bryce, tell me what I'm leaving out, because I'm sure there's a bunch of others.
Well, so in terms of how do we just rank people in some idealized sense, yeah, I mean, we're based, it's really okay. Well, how much good do you do for society?
Mm,
And we can quantify that in a variety of different ways, but that's roughly what we're trying to do. We're just trying to say, well, look, how much good do you offer? And we want to make sure that, and then we want to weight that by the risk of that going away if you got COVID, right?
yeah.
Uh, and so we would say, okay, well, we want to add that up. The challenge of that, obviously, we're never going to get a specific ranking of how much good do you provide society. We can use some crude proxies like,
Then we could ask Facebook what they have calculated in their algorithm for all of us, right?
but yeah, I mean, we could try and do, yeah. I mean, look, there's lots of ways that we could. We're never going to ultimately do it, so it's worth introducing at this point some more reality,
Yeah.
right?
Yeah.
Because what we've seen so far, right? The plans that exist, such that they exist, they use things like age, health status, and occupation,
Hmm.
right? And you can say, okay, well, let's see how that kind of maps into risk, maybe sort of yada yada yada. But like at some point, we have to move to the actual practical realities of, well, look, okay, so how I view a lot of the plans, such that they have at least been reported on, they're statements of values. They're
Yeah.
not really actual plans for distributing a virus or a vaccine,
Hmm.
right? They're basically saying, well, okay, healthcare workers go first, and then old people in nursing homes, and then old people and people with two comorbid conditions, and then these occupations, and then one comorbid. And I look at that and I go, okay, that's a nice statement of value. We're basically trying to minimize the life lost in some crude sense. But when you get to the actual distribution of the vaccine, like, how are we observing all this stuff, right? Like, a lot of this stuff isn't observable.
Right.
How many comorbid conditions do I have, Justin? Do you know?
Hmm. Yeah.
Like,
Hard to diagnose via this Zoom platform we're using.
yeah, and oh, and more importantly, how many live in each town? Because I got to get vaccines to the right place at the right time. And so, while it's nice to have statements of values, we do run up against the reality of the real challenge here is we want to get vaccines from the factory to a place where they're distributed and then administer them to people in some sort of social welfare maximizing order. And just saying, well, we want the order to be this, like, that's great, but we don't all walk around with something stamped on our head. And to the extent that we basically say, well, we're now going to have to impose a whole verification process. That quote from the New York Times that you listed, well, who's doing all of that work,
Yeah. Yeah,
right?
exactly.
Who's going out and saying, first of all, we've built the statistical model so we know that in Glasgow, Montana, there are this many people who are over this age or in this occupation or have this many comorbid conditions, right? Because without that, you're not getting the vaccine. Well, now who has it and when? And so, what I come back to is, well, it's nice to say as a statement of social value, we would like the the line to go like this. I just don't see how, as a practical matter, you can organize people into that order without creating an enormous amount of work. And my big concern is that the process of doing all that work slows down the end date,
Yeah.
right?
Yeah.
Right. So we could have everybody vaccinated by this date, but because we're going to try and put everybody in line, we're going to extend the vaccination process by months.
Yeah. Yeah, I mean, and that sort of deals with sort of the supply side as well, the constraint. It's why that story and the story that came out yesterday about potentially missing out on 200 million additional doses, and that pushing sort of the expected date for most people in the country of March back to June. That time factor is just so important. I mean, time is how we've measured this virus in so many ways. I mean, the length of time you're exposed has influence on your likelihood of contracting the virus. The length of time between contraction and treatment, and that sort of time is such an important variable. And we mentioned at the head of the show, like, hard to sort of understand how time is going by, but the difference between getting the vaccine in March and getting it in June, whether it's a supply side constraint or that, whatever authority hasn't figured out where I fit in the line, I mean, that makes a huge difference in people's lives and sort of the overall health of our society as well.
Yeah. And so it's one of these things where, again, it's useful to have a statement of values and say, we want the line to look like this.
Hmm.
But you can't just say, okay, we want the line to look like this without also asking, well, how much work is it to actually put people in
Yeah,
that line?
right.
Who's doing that work? And particularly if we're not funding that work, how much does that delay the administration of the vaccine?
You would
And
think that a way to kind of maybe address that would be on the other side, like invest so much in getting your hands on as much of the vaccine as possible that the particular, if you've got a line of 330 million people, that the particulars of where you fall in that line are sort of, and where exactly you should fall are kind of made irrelevant by the fact that we just have so many doses that we don't have to be that granular with decision making.
exactly, right? So the way to alleviate scarcity is to alleviate the scarcity,
Right, exactly. You said
right?
it much more elegantly than I.
Like, yeah, I mean, I don't need to worry about enforcing the line if the difference is, okay, I got it this week versus a few weeks from now. Like, yeah, a few weeks matter for those who are caught in that margin. But if the difference is like you get it in March or you get it next March, right? Well, now I'm going to fight a lot harder for my spot in line,
Yeah.
right? Because so abundance solves problems, right? So yeah, like to the extent that we have failed to make this as abundant as possible, as quickly as possible. Now, somebody will get those vaccines. So from a global perspective, it doesn't matter. So,
Hmm.
it's really just from, now this is a narrow American problem. But to the extent that, yeah, we in the United States will have less abundant vaccines, then yeah, now that line and who's in it and what order, those decisions start to matter a lot more. And so, yeah, the easiest way to solve the problem is if you're basically saying to people, look, only this many people want the vaccine anyway. We're gonna be able to get everybody who wants to be vaccinated a vaccine by June. And, if you're saying like the earliest I was going to get it was March anyway, like March, June, okay, I care about 3 months, but like, you know, or a month or 2 months, but like it's as you extend out, you push that line, time waiting in line goes out, that, yeah, now it really does start to matter who's in order. And, well, okay, I guess now we're going to have to invest in, making sure that we have a whole verification process so that, people aren't cheating in line, and now that increases the odds of a black market.
Yeah, the cheating in line, right? Like the incentives that this line function introduces in terms of bad behavior and sort of buying your way up in order, or just simply, you don't want to necessarily make it all nefarious. I mean, there are people that are just more aware and are going, or have easier access, not because they're doing anything unethical to give themselves an advantage, just because they're more informed, or for a whole host of reasons. But that just could give them access to moving themselves up in the line, and then there's all sorts of reasons why somebody would cheat as well, for a whole host of reasons.
Look, it's valuable,
Yeah,
right?
yeah,
Like, and this is, I said early on in one of our podcasts when we were talking about markets, right? That when you have faced with scarcity, you have three options to allocate thing. You can use a market and the price mechanism, you can use social connections, or you can use time, right? And, the question is, well, nobody is really talking about using the market. I do find that interesting and somewhat odd, to be honest.
yes,
Uh, you know, because the big concern, which you already raised, which is the problem with markets, is twofold. So first, they don't account for social benefits; they only account for private benefits for the most part, right? And second, you know, will willingness to pay is a function of ability to pay, right? So I have more money than you, I can pay more for the vaccine. So people with money get the vaccine first, and that seems grossly unfair, right?
hmm,
But there's ways to design around that while still allowing some sort of market mechanism to kind of help ensure the efficient allocation of resources. One way would just literally just give everybody a spot in line randomly, or randomly weighted by some social function like risk. But then once you have your spot in line, just like it's like owning a ticket to the concert. You can sell it if you want, or you can keep it and use it, or you can trade it.
yeah,
And so, you get some of the inefficiency of trying to enforce a line is that, as we talked about earlier, we don't really have a good mechanism of putting people in line. So, look, imagine a family and you gave it out randomly or randomly weighted by some risk factor. Well, then the family could get together and say, well, we've got these slots. Well, let's make sure that grandma gets the first one. And, the person at least, we could make decisions for ourselves without having to then, what I'm afraid is going to happen is that somehow you're now supposed to go through your doctor to get
yeah,
it.
yeah,
And now my doctor has to then hire somebody whose sole job is when I call up and say, "Hey, I'd like to get the vaccine," is to look up my chart or do some sort of screener with me to then say, "Well, oh, nope, you have not the right conditions or whatever it is. And, that's just a lot of time and effort. And, you know, we actually have a vaccine distribution system that gives out 170 million doses of a single vaccine every year,
Does? Yeah. Flu
the flu
vaccine.
vaccine. And it works really well. And so, to the extent that, yeah, there's got to be some queuing, right? There's going to be some line or whatever it is. And, but the simpler we make that process, I think, with some exceptions for like obviously high value people like healthcare workers or
Yeah.
whatever it is,
Yeah.
it just seems like we should be using something simple like age.
Yeah, and then, as far as execution goes, Bryce, I mean, this is still one thing that's baffled me. And maybe I'm holding up sort of this romantic notion of how the country mobilized public-private partnerships in times like World War II, but why don't we just give syringes and vials to like every Amazon Prime driver, right? I mean, that selects like a certain number of people, but as far as like getting the vaccine out to people, like yeah, you mentioned it shouldn't be administered through your doctor's office necessarily. Yeah, you want somebody with medical
That's great. It's
qualifications
a great
sticking.
place. You could definitely go there. But like, I got the vaccine at a pharmacy. My flu vaccine, I
Yeah,
got it at a pharmacy, right?
right.
Like, why do I mean, doctors have other things to do,
Yeah.
right? And it's fine if like I sometimes I get the vaccine like, when I've gotten the flu shot, it's like sometimes it's like, oh, I happen to be at the doctor and it's flu shot season.
Hmm.
And they'll say, "Would you like a flu shot?" And I'm like, "Sure. Let's check that one off the box while I'm here," right?
Although we should flag that this particular vaccine requires like ultra cold storage, and there's some other
The Pfizer
constraints.
vaccine does. The Moderna
Yes,
one doesn't,
right,
right?
right.
The Moderna one normal stuff. So like, I mean there's yeah, and that's, look, and there's complicate, there's other things that go into this vaccine that are not just a flu vaccine, like because it's an emergency authorization, we all have to like sign waivers.
Hmm.
uh,
Yeah,
because it's not been through like long-term testing and, we don't know what the long-term effects are and all that kind of stuff. But, for the most part, what we want is somewhere between 50 to 70% of people are like, yeah, I'd like to get the vaccine. We have a production, they're going to produce as much of it as quickly as possible, right? We want them producing as much as possible, right? So to the extent that there are investments we can make to increase their capacity, like let's go ahead and do that.
right.
But while we're in this period between while production is still going up and ramping up, yeah, there's going to be some queues and some lines and some shortage of whatever it is. And yeah, we kind of want to direct that maybe a little bit towards people who are at more risk than less risk. But if we know, and presumably we can do the math on this, right? Like here's how many doses we'll have at this various points in time, right? And then it's just a matter of saying, okay, well, if whatever, and I actually don't even know. I mean, I've heard some things like, kids aren't even actually going to be able to get it yet
Yeah,
because
yeah.
we have higher standard for kids,
And
right?
we don't have
So
adequate, I shouldn't say adequate, enough data on children as well.
yeah, so like, so if you're saying, okay, well, we're really just focused on the adult population in the short
Hmm.
term, right? So we've got 200 some million adults. Well, and 60% of them want to get it. So, well, when are we going to have 120 million and, two doses are what you need? Although that's another issue, which I don't know if you saw the chart from the Pfizer thing, the
I
cool,
did.
like,
Yeah.
I mean, it seems like one dose seems pretty effective after 14 days. So,
Right.
that's a whole nother issue. But okay, so we need two doses. So when are we going to have 240 million vials of vaccine available? And, for the US between the all the different vaccines. And, if we kind of can do that math, then we can kind of work backwards in terms of, well, if everybody who wants it's going to have it by June, do I really need to go crazy trying to keep somebody who would otherwise get it in May from getting it in April?
Right. Right.
Right? Or do I just want to go all in on, that person that we would need to hire at the doctor's office to go up and look up your chart to see if you have the right number of comorbid conditions to be able to get it? And I don't even know how you verify occupation. It's not like we have cards.
Yeah.
I'm an essential worker,
Yeah.
right?
So much
Well,
of it is
prove it.
unverifiable. Yeah.
You know, I would much rather take that person and train them on how to administer the vaccine than have this verification process. And so, I mean, the where I've gotten as I've thought about that in terms of thinking about this, and I could be wrong, is I would rather invest on shortening the end date
Hmm.
than worry too much about the order between now and then.
Invest in manufacturing capacity supply.
Well, and administration, making it,
Administration.
making
Yep.
sure,
Pushing
because
it out as
it's not
fast as possible.
I got to produce it, I got to put it on trucks, and I got to get it to places,
Yeah.
right?
Yeah.
And that's why simple allocation mechanisms like age are easy, right? I can just look up in the census. Well, okay, we're going to do everybody over 65 now. Okay. How many people over 65 live in each town,
Hmm.
right? Great. Send that many doses, right? I don't have to try and figure out a whole bunch of other stuff that isn't necessarily observable to me or easily observable to me.
Yeah.
I can just say, well, look, and then there it is. And then you say, all right, it's January. If you're over 65, come on down or make an appointment, right? And, the more appointment slots we have, the better. I would rather have more appointment slots and get those people vaccinated quicker than spending effort that we don't have in the system, capacity we don't have in the system already, trying to say, ooh, you're 65, but you only have one comorbid condition.
Right.
And
Exactly.
so we got to tell you no. We go the whole process of fighting with you. I would much rather just go all in on let's shorten the end date and let's worry less about the line and just focus on, because the reality is if it's moving quickly and efficiently, people will care less about where they are in the line
Yeah.
because
Exactly.
I don't care where I am in a line that's moving fast, right?
Hmm.
Like it's when the line is stuck and stalled that I hate being in the line.
There's all kinds of research on line effects. How you feel a lot better once somebody gets behind you in line, even though you've gotten no closer to the front. Bryce, this is the moment where we should probably bring it to a close. I mean, essentially the conclusion is, this is a really hard problem to solve. There's a lot of ways we could solve it. We talked about a few today, but I think we're in agreement that, the more to the extent that we could be swimming in vaccines, we should be. And that's probably our best path to success. In our closing moments, we have to finish out with predictions. Bryce, do you have a prediction for this episode?
So I think the initial when you're just giving it to healthcare workers, the vaccine stuff will go pretty well. I think that once we try and start moving out into the real world, unfortunately, I think it might go poorly.
Yeah.
I was optimistic, and then I had a conversation with a bunch of my economist friends over the weekend, and they were like, "There's no way we're going to administer all those vaccines that fast. Like, what's the process? How's it going to get there?"
Yeah.
And I was
Don't you
like,
remember what you did with my U2 ticket?
"Oh, wait a second."
Yeah.
And so, it's really unfortunate, right? Because we knew we were going to have this problem for a year,
Yeah. Yeah.
right? We should have
Exactly.
had well-designed, super cool allocation mechanisms to distribute the vaccine. And what we have are kind of, like I said, I feel like we have a lot of things that read to me like value statements, not like nuts and bolts. And hopefully it's just obscure, it's not being reported on. There's much more, investment in this infrastructure than I'm aware of, but certainly I am not aware of it, and that concerns me.
I think that is well, it's not a good prediction. It's a sound prediction. We'll have to see. I'm going to shift gears with my prediction. I've been doing this bi-weekly segment on the Tutel and Nuanez sports talk radio show here in Missoula, 102.9 ESPN Missoula Radio. That's just starting to roll off the tongue. That was pretty good, I think. But anyway, yeah, I've been doing this segment every other week called the Business Angle. And, just sort of talking about business and sports. And so I've been tracking a little bit college sports, in particular college basketball, the last couple of weeks. And the NBA gave us a great example of how to operate in COVID times with their bubble. And it looked like college basketball might head toward that, and you're seeing pockets of it, but we're starting to see real cracks. And some of the signs of those cracks are prominent coaches and voices. Mike Krzyzewski from Duke, Rick Pitino early on, Tom Izzo, Michigan State. I mean, these are the sort of preeminent power teams in the NCAA. Coaches coming out, casting doubt on whether or not the season will continue. So my prediction is, college basketball is gonna get shut down in the next 3-4 weeks. I'm sad to say it, but it's probably in the best interest of the coaches, athletes, and all involved. So we'll see how that goes.
Just delay it, right?
Well, that's the thing, right? And that's what Rick Pitino said. He said, there's nothing wrong with May Madness. It doesn't have to be March Madness. So
absolutely.
Yes.
We know we're going to get seasonal effects. We're going to get vaccine effects. We're going to get, kind of just gross herd immunity effects, natural herd immunity effects. Like right now is the worst time. It's as bad as it's going to get, hopefully, between now and whenever we choose to bend the curve a little bit more. But I mean, college football is a mess.
It is 100%.
I mean,
just press pause.
It's unwatchable.
Yeah.
I made the decision early on that I wasn't really going to watch it, but I managed to watch a part of a game a few weeks ago. I was like, are these guys even trying? Do they realize that it's like they know this is not a real season? Like in the Pac-12, they don't even know who they're playing. It's like Thursday, and that team's gonna go not gonna be able to play this week, so you're gonna go find somebody else to play on 2 days' notice. It's a mess. It's just I don't understand it at all. At this point, particularly now that we have a vaccine, it was calculus changes a ton once you get to we're going to be able to vaccinate people in some mass fashion, and that will significantly change life. And the NBA played out of time, right? Like the NBA finals were what, October?
Yeah, something late, late summer or early fall, something like that.
Not as many people watched it because it wasn't when you're supposed to be watching the NBA, but
it happened.
It's the only sport that's taken place thus far that I don't think has a significant asterisk.
Yeah, agree.
Right? Because once they went into the bubble, everybody stayed in the bubble, right? You didn't have this weird thing like Denver playing without a quarterback, or whatever's going on in the NFL, bouncing around. And Major League Baseball, the season was just so short, right? That a 60-game season isn't really a
people forgot it even happened.
Game season.
Yeah.
And so it's like, just wait, and you have fans, right? At least in some sense, right? Hopefully hundreds of millions of us will, or tens of millions of us will be vaccinated by March. So you can open your stands up again. Why are we trying to operate in this environment? It's crazy.
Seems like once we set balls in motions, particularly institutional balls, it's really hard to pause them, stop them, change direction, etc. We'll see. But we set this ball in motion, Bryce. Well, we set it in motion 3 years ago with our first episode of A New Angle, and then we set this Incentives and Instincts series in motion a year ago. I'm thankful for our friendship and this collaboration. I'm looking forward to what happens in 2021, and turning the page on 2020 will feel pretty good. We'll see all of you, at least in this series, in the new year. This is the last episode of Incentives and Instincts for 2020. And Bryce, it's been a pleasure. All the best to you and your family for a safe and healthy holiday season.
You too, Justin.
Thanks for listening to A New Angle. We really appreciate it. A New Angle is underwritten by First Security Bank and Blackfoot, with support from the University of Montana College of Business and Consolidated Electrical Distributors. AJ Williams is our producer. Jeff Ament, John Wicks, and VTO made our music, and Jeff Meese is our master of all things sound. If you have any questions, suggestions, comments, insults, whatever, please email me at anewangle@umontana.edu. If you like what you heard, tell your friends about us. Thanks a lot, and see you next time.